And good evening. Welcome to Call the Doctor. I'm Sandra Smith and I'm sitting in tonight for Jean Kitchen. And this is Vantreia Gross, and she is sitting in tonight for Dr. Kimker. So
Yes.
We need a different perspective sometimes. You know, Dr. Kimker talks a lot about knees. I know y'all have heard a lot about knees, and so we're going to have a little bit of a different topic that you really need to hear tonight, and that is wound care.
Yeah.
So anybody that needs to know anything, you know how to call 407-1111. Give us a call, and we will take your call, and we will try to address the best we can your question. So anyway, we're going to start with Vantreia, a little history. Tell us a little bit about yourself.
Well, I'm originally from Maryland.
Okay.
I was born in Baltimore and raised on the eastern shore of Maryland. And it's been interesting. Ironically, my small town is similar to Rocky Mount. So
Okay.
moving here was just like moving to my town.
Wow. Okay, a lot of blue crab in Maryland.
Oh my gosh, yes.
Love them, love them.
Crab cakes, blue crab, oysters.
Gosh.
I mean, we have seafood galore.
I have family in Maryland. That's
Oh
how
yeah.
I always, when I go there, they always, I always want to eat blue crab. When they come here, guess what they want to eat?
Barbecue.
Barbecue.
Yes, I get
It's
it.
funny the way that works. But
When I go home in the summer, my dad makes a point of going to get crabs.
Right.
And you know, you put the paper out,
Right.
throw the crabs down.
Yes.
Usually it's a bottle,
Uh-huh.
but you know, I guess we're now sophisticated and use crackers.
Yeah.
But it used to be a bottle and a butter knife.
wow,
And
yeah.
it was amazing.
They are amazing.
Very.
So what made you want to be a PA?
So I grew up in a medical family. My dad was an EMT.
Okay.
And I was the kid that never really went outside to play. I went to look for his books, his medical books, and you know,
Okay.
looking at eviscerated organs and amputated body parts, and I found all that interesting.
Okay.
And so we've had a lot of, you know, emergencies in our family when I was younger.
Right.
Usually my brother, sister, and I were doing stuff we shouldn't be doing.
Right.
And I can't tell you because my parents might be watching. So
Okay.
but we would do, you know, a lot of crazy things
Yes.
resulting in injuries, and I was very quick on my feet. I think well under pressure, and so I love medicine. And I knew at an early age I was going to become a doctor.
That is so amazing. And it's so good to see I can tell you're passionate
Oh, yeah.
about it.
Oh, yeah.
And it's so good to, you know, for your passion to come through. So how long have you been a PA?
17 years.
17 years?
I literally felt like I just graduated high school or college.
And you started where?
In Maryland.
In Maryland,
Yep.
okay.
So I graduated from University of Maryland Eastern Shore.
Okay.
And I graduated with a bachelor's of physician assistant.
Okay.
And I moved to Baltimore and got to work. And I
what a
worked.
big city.
Yeah. My first job was in orthopedics. And I was at a level 2 trauma center. And so I got to see everything. And it was amazing. I grew and learned so much. I worked with some amazing doctors. And I traveled after that. I stayed there for 5 years,
Okay.
and then traveled through the Midwest for 4 years as locums tenens.
Okay.
So basically, it just means like a traveling PA.
Yeah.
And so, had a blast and learned from some more amazing doctors.
And so why did you plant in Rocky Mount?
Ironically, the job called. So my mom had some surgery, and so I'd come home and helped her for a little bit. And then I decided that, you know, I was done with the tornadoes because I'm not Dorothy.
Right.
And I wanted to come back to the East Coast. And I got a call from a headhunter.
Wow.
And he said there's a great opportunity in Rocky Mount. I have no clue where Rocky Mount is, but okay. And so, you know, like normal Americans, I Googled it.
Yeah.
And it was a really nice town. I mean, you're not far.
We think so.
Yeah, I do. I love this town. It's small enough that you know your neighbors, but it's
Yes.
big enough to be considered a pretty major town.
Right.
The cities near us are not far away.
Right.
And there's always something to do. This town is really growing.
Very good. Well, You know, it's always good to hear that perspective about our town because I've been here my whole life, so I can't probably see the forest for the trees sometimes.
Yeah.
But to have somebody from the outside come in, you know, it's good. It's always good to hear that. So you've been at Carolina Regional how long?
7 years, the entire time I've been here.
Oh, that is wonderful. Okay. And I have heard good things about you. I really have heard good things about you. So do you primarily work with wound care there, or you just
I do a little bit of everything.
A little bit of everything that a PA does at an orthopedic office.
Yes, my passion is wound care. I love wound care, and I actually got started when I was a locums. But I do some orthopedics, I do some pain management.
Okay.
We have multiple specialties within our orthopedic practice, so I do a little bit of hand. I work with a doctor who does shoulders, work with another doctor who does joint replacements.
Okay.
We do generalized trauma there, and then I do wound care.
Wow, you do a lot.
Yeah, it's interesting.
PAs are always interesting to me because, gosh, y'all know so much. You know, when you leave the room sometimes, you know, I'll think, you know, when a PA leaves the room, I'll think, wow, you know, that's exactly probably what the doctor would have told me. It was so, you know, you're so knowledgeable. So
ironically,
anyway.
I didn't know PAs existed. I'm a vet. I was in the National Guard, Maryland National Guard for, I'd say about 10 years or so. And I was in a medical group, and I was a medic, and we had PAs within our unit, and that is how I learned about the specialty.
Okay.
And you know, talking to them, I always knew I was going to be in medicine.
Right.
And I just knew I was going to be a doctor, but I couldn't see how that was going to work because I needed to get through school.
Right.
And most people would have to work.
Right.
And so I figure, oh, okay, well, I can become a PA. They make really decent money. I can work, have one up on the med students.
Yeah.
You know, I've got it made.
Wow.
I went through and I just love it. I absolutely love it.
Very good. Well, your passion definitely shows through, as I said. So let's talk about wound care a little bit. What constitutes a wound?
Any opening through your skin. So our skin is our biggest organ. Okay, and it protects us from any germs, anything from the outside getting in, bacteria, and fungus, anything. When you have an opening in that skin, that barrier, anything can get on the inside.
Right.
And when you have some people that have difficulty healing due to any type of vascular problems, any generalized health problems, sometimes age.
Right.
The integrity of your skin or how well your skin bounces back,
Right.
then that can be a problem healing on your own. And that's when you would need to seek some help. And that's what we're here for.
At what point do you know you need to seek help?
If you want me to be honest, you can come right when you have your injury.
Okay. Okay.
You don't have to wait. And it saddens me to see people dealing with some wounds for, you know, years. I think one person has had a wound off and on that I've taken care of for 10 years.
Wow.
And that can really affect your life.
Yeah, absolutely. So you said for 10 years off and on.
Yep.
So does that wound, so it's the same wound that keeps coming back?
Yes.
So how do you get that healed?
Education.
Okay.
So a lot of times, most of those wounds are a vascular wound, venous wounds.
Poor blood flow.
Poor blood flow, absolutely, but then swelling. So anything that swells can actually break the skin apart.
Okay.
And if you don't control the swelling, the skin stays apart. And remember, barrier in the skin.
Right.
A break in the skin.
Right.
Bacteria gets in, infection happens. And so these are the type of people that have really super swollen legs, discolored legs,
Right.
Hard skin on their legs, dry legs, really scaly legs.
Right.
You know, anything like that That's usually a venous problem or an arterial problem. We have people that help us decide what that is.
Now,
They're vascular
explain
people.
venous. When you say venous, what is that?
So your venous circulation is it's when the blood goes back to the heart. Arterial is taking the blood away from the heart.
Okay.
So most people know of aorta. That's your biggest artery in your body. And then your vena cava is your biggest vein in your body.
Okay.
And so when you cut yourself, if you see bright red blood, that's usually an artery.
Okay.
It's got a lot of oxygen, good blood.
Okay.
If you cut yourself and you see dark blood, that's usually venous. That's blood that's already been, the oxygen's been dropped off and it's heading back to the heart.
Right.
And so a lot of times, if you have a problem with your venous circulation, the valves that hold the blood are supposed to go like this.
Okay.
So then some end up like this. And so that break, the blood comes back down and pools at the bottom of your legs.
Oh, wow. Okay. Interesting.
Yeah.
Very interesting. I know you all are finding it interesting. I'm learning a lot because about something that I never really thought about.
Most people don't. They just know that, they wake up and they notice their legs are changing and they don't know why. And I mean, you definitely can talk with your provider. Google is a great resource. However, sometimes Dr. Google is not the best.
Right.
So it's great to take that information to somebody who knows what they're doing and can help you explain it.
Well, I've heard, Vantreia, we've interviewed, doctors, primary doctors, doctors that, treat diabetes. And they say, I cannot get some of these patients to wear shoes that are diabetics. And they're just asking for trouble, aren't they? I mean, around the house.
No.
Around the house.
That is a huge, huge problem. If you have what we call diabetic peripheral neuropathy, or you cannot feel your feet, if you have tingling in the bottom of your feet, if you, it feels like if you were to sit on it and it gets numb, that's not good, because you don't know what you're going to step on. You don't know if you're going to hit your toe. You don't know if, you have cut your nails and you cut your nails too short. Anything can happen.
Right.
Your feet can be super dry, and like any dry skin on your body, it can crack. Pathway for infection.
Right.
So it is imperative that if you have diabetes, actually not even just diabetes, if you have feet, wear something on your feet in the house.
Right. Exactly.
Anything can happen.
Absolutely. Well, I just heard, it just made me think when you were talking earlier about it. One of the physicians, as I said, that we had on, and he said, just can't get some of my patients, diabetic patients, to wear shoes, and then they get in trouble.
Yeah, and it's awful because, when you start losing body parts, it never stops with one.
Right, right.
So
that is scary.
It very. But I do my that's never my goal. That is never my goal. That is my last effort.
Right.
And I have run out of every option I could think of.
Right.
Any option I have consulted with others can think of, that is my very last goal, is amputation.
Right, sure.
My
Absolutely.
goal is to give you the information and empower you to make the decision on your own, that you never have to come and see me again. That is my goal.
I also have heard, this is kind of a myth, but I've heard people say, well, I'll just put peroxide on it and it'll. Now, I have heard the opposite from what people say about peroxide. Can you dispel that?
Yes, ma'am. Peroxide is great. Peroxide does wonders if used appropriately. So if you have a fresh wound, that is when you use peroxide.
Okay.
After that, do not use peroxide, because peroxide will actually kill the good tissue.
Okay. Well,
Soap and water are very good friends with each other. Very good friends, and they should be our friends.
Okay.
And that is, if I have to tell somebody to clean a wound and they are lower socioeconomic, they cannot afford a lot of the things that other people may. Soap and water is amazing. Friction is what kills germs.
Okay.
So if you use Dial for 10 seconds and Dove for 20 seconds, the 20 seconds is going to be cleaner than the Dial.
Well, you know what they always say about washing your hands? Friction is correct.
I tell-
Because, you know, do it
I tell
many
patients,
times.
scrub like your life depends on it.
Yes. Very good. Okay. Well, we're going to take our first break. This has been very interesting, very informative, Vantreia. Thank you so much.
Thank
We're going to
you.
go to break, and we're going to come back with you. And hopefully some of you will call 407-1111. And that's the number down there for Carolina Regional Orthopedics. Tomorrow, if you want to call and make an appointment about your
Monday.
wound or anything.
Monday.
Oh, y'all are closed on Friday.
closed on
They're closed on
Fridays.
Fridays, y'all. Monday, Monday, Monday. So remember that, 443-0400. So we'll be right back with some more information on wound care right after this.
It was fantastic. He was different from everybody else I'd ever seen. He's compassionate. He really cares about his patients. I told him, you were my guardian angel. My experience with Nash was A+. I said, any surgery I need here on out, give me a blank piece of paper, I'll sign it. I want you to do it.
Learn more at nashsurgery.com.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mount area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't rise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
What is Celebrate Recovery? It's a Christ-centered, faith-based recovery program for anyone dealing with life's hurts, habits, and hang-ups. Celebrate Recovery meets every Thursday night at 7 p.m. at Farmington Heights Church in the Wilson, Raleigh, and surrounding areas. Please join us every Thursday night at 7 p.m.
And welcome back to Call the Doctor tonight. We have Vantreia Gross, and she is talking about wound care, something we have not addressed on here. And if we have, it's been a long time. So I think it's so, so important, because we do want to save those amputations if we can.
Always.
Yes.
Always. Save a
So-
limb, save a life.
Yes, so if we know what to do, sometimes prevention can be so important. So let's talk about the different types of wounds.
So there are multiple types of wounds. You have your burns. There are the most common ones that most people think of, diabetic wounds. There are vascular wounds that can be broken up into venous and arterial. There are your neuropathic wounds, which I guess your diabetic wounds can encompass that. So neuropathic wounds are wounds that happen because you can't feel something. And that skin has been resting on something for a very long time. The pressure would end up causing an opening in the skin. It causes the tissue under the skin to die, and then the pressure just opens everything up.
Okay.
There are trauma wounds. There's skin tears that most people just don't think enough about, and that happens a lot in our elderly population. When they have a fall, if somebody were to grab them too hard, it's a shearing force.
Okay.
And so it just tears their skin. Their skin is pretty much like paper. So you just have to be very careful when you're handling people with thin skin.
Okay. Wow. So I want to go back to, I believe it was the second one you just addressed, second one you talked about. Trying to think about what you said. I had a question about it. What was the first one we talked about?
I think I mentioned diabetic wounds.
Diabetic wounds.
And then vascular wounds.
Yeah, explain a little bit to people how you could get a vascular wound.
So a lot of times it happens, especially in venous wounds, it happens when you have extra swelling in your legs. So that can come from poor circulation, as I mentioned before, where your veins are not closing properly, and it allows the blood to pool at the bottom of your legs.
Right.
It changes the skin color. So if you are very fair-skinned, it actually can change your skin color to a reddish, ruddy color. If you're darker skinned, it actually can make your skin a lot darker than your normal skin.
Okay.
It can be, venous wounds can be dry.
Okay.
And look really scaly, whereas arterial wounds are very shiny.
Right.
Their skin looks, it kind of looks like polished marble,
Okay.
if we can think about
Yeah.
that. With venous wounds, you don't see a change in the hair on your legs.
Right.
But with arterial wounds, you start losing your hair.
Wow. Okay.
And so somebody who could have been very hairy when they're younger, they may have 5 or 6 strands on their leg.
Okay.
The nails on their toes start changing with arterial wounds. And so I think the biggest thing that we can do to avoid that is with venous wounds, compression. With arterial wounds, you need surgical intervention.
Oh, wow. Okay.
You need surgical intervention with venous as well, but with arterial, you definitely need surgical intervention.
So what would surgery involve? What would they do?
Well, I usually send people to vascular surgery.
Okay.
And the first step is getting a detailed history, kind of like I would.
Okay.
They would check your pulses. They have a machine called a Doppler, and they check your pulses and make sure that you actually have good pulses.
Okay.
They may end up doing an ultrasound scan. It's called a duplex study.
Okay.
Or a Doppler. And they make sure that the blood is actually flowing. So remember, venous away from the heart. So blood is flowing away from the heart and going to where it needs to go. Arteries going back to the heart.
Okay.
So adequate blood flow.
Very good. Okay. Got it. I got it. This is a very good topic. I'm just so glad you're here tonight.
Oh, I love wound care. Love wound care. I could talk about it all day long.
So do we have a question, I believe?
Yes. How do you know if the wound's infected?
How do you know if the wound is infected?
That's actually a really good question.
That's a good question. Whoever called that in tonight, that's a good question.
So a lot of times people think that if your wound smells, it's infected. It's yes and no. So the reason I say no is because the dressing is going to smell. All dressing should smell.
Right.
In order to truly know if it's infected, you take the dressing off, you clean your wound and let it sit for a second. Most wounds that smell and are not infected, the smell goes away.
Okay.
If it is infected, you're gonna know. It has a very strong odor.
Okay.
Soap won't even work. It has a very strong odor. There is increased drainage. Sometimes the drainage can be colored. So if it is greenish or thick, white, that's a problem.
Right.
If it has heat to the area, also fever, that's a problem. If it is hot and it's not necessarily warm, but fever hot.
Right. So you can kind of feel
You
up
can
the wound
feel it,
and
yes.
see if it's warm around
Yes,
it.
and if it's red.
And red.
So, yes, you have different colors red. Most people think that a little bit of pink on the skin is red. No, stop sign red.
Okay. Okay. Got it.
Stop sign red, yes. Ironically, in people who are darker complected, you won't be able to see red. So you're going to know that if it is a little purplish or sometimes it can be red, but usually it's a different color than the rest of your skin.
Right. Now, okay, let's say it's infected.
Mm-hmm. And it usually hurts. I forgot the main thing. It usually
Okay.
hurts.
Okay.
Mm-hmm.
That makes sense. So if it's infected, what do you do then?
Call
If
us.
they come, yeah, that's the time to call you immediately,
yes.
right?
Call immediately. Honestly, you can even walk in to get an appointment.
Okay. Well,
We
that's
do
good
have,
to know.
yes, we do have an urgent care. Our practice has an urgent care.
That's right, you do.
Yes, so please walk in. I'm there Monday to Thursday. We are always open to see you. My wound care days are Mondays.
Okay.
However, I don't care.
Okay.
I want to see you and we can get you on the schedule.
Okay. Very good. So you have the infection. Is this how we get sepsis? Does it
Yes.
go into the sepsis and things like that?
Yes,
That's
it is
scary.
very unfortunate because if your wound is infected, remember the infection is a break in your skin.
Yes.
You still have blood flow going there. Well, that same blood flow that's going can take stuff away. And the bacteria can then get in your bloodstream. So then not only is your wound infected, you become infected.
Oh, wow.
So you start having fever, you start sweating. Usually the sweating is at night sweats. You start having chills. You start having increased tiredness during the day. Sometimes people are delirious. They might, for lack of better words, talk crazy out of the head.
Wow.
Yeah, it is pretty serious. So if you even think that your wound is infected, you need to come see us.
Yeah, at that point, you don't want to try to take care of this
No,
yourself.
no.
You definitely need professional help
Yes.
when it gets that way, because you're trying to do, you're trying to get this taken care of as fast as you can, because you do not want it to lead to an amputation.
And that's actually the biggest myth, is just because you have an infection, we're going to amputate you. No.
And I think that's,
Why
it is
people
a
are
myth,
scared,
and
yes.
people get so scared about it. They really do. And if they catch it and you go on, there is treatment.
Yes.
I mean, y'all are the professionals. You know what to do for it. I mean, as we said earlier, don't just go in there and pour peroxide on it thinking
No.
that everything's going to be solved.
No.
There's more to it than that.
Yes.
If they go to you, I mean, what are some of the things you try to do for it once we go to you?
Excuse
What
me.
do you do?
So when I first meet a patient, I take a very detailed history. I basically want to know your life and everything in it. I want to know your eating habits. I want to know, if you're still working, smoke, if you have help at home. A lot of times people are dealing with this by themselves, and it can make them feel very discouraged.
Wow.
And so if you're dealing with this by yourself, we have help for you. I just need to know all of that. And so, like I said, we take a very detailed history. We do x-rays to make sure that nothing bad is going to the bone. We do lab work because I want to know what's going on inside of your body, not just what the wound looks like.
Okay.
So a lot of times if we're not properly hydrated, if we're not getting enough nutrients, then you're not going to be able to heal your wound.
So all of these are contributing factors
Absolutely.
to your wound healing.
Absolutely. Diet, hygiene, if we're being honest, home environment. If you smoke, smoking is the absolute worst thing that you can do for your wound.
Wow.
Remember we talked about the arteries and the blood vessels?
Yes.
So those are the big things. However, the really tiny arteries and the really tiny blood vessels that supply nutrients to our skin, when you smoke, those get clogged.
Wow.
And
Well,
so
yes.
and so if you don't have those open to deliver what you need, you're never going to heal.
This is so good. We're going to take a break. Well, I think we have a call first. Let's take our caller. Yes.
How long does it take to heal typically?
It all depends on the patient, to be
Okay.
honest. So how long it takes to heal, it depends on the patient.
How bad it is when they come to you. all
Honestly,
of
yes.
that.
So a lot of times, if it is a what we call a fresh wound or a traumatic wound, it happened within, a month or so. Those are not that hard. If this is a wound that we've been dealing with for years, several months, things like that, it can take a little bit longer.
Right.
We just kind of have to get your body to remember that it is a new wound. And a lot of times when your wound's been hanging around, it's like that crazy cousin we have.
Right. Mm-hmm. Interesting. Okay. We're going to take our break. We'll be right back with you right after this.
Fantastic. He was different from everybody else I'd ever seen. He's compassionate. He really cares about his patients. I told him, you were my guardian angel. My experience with Nash was A+. So any surgery I need here on out, give me a blank piece of paper, I'll sign it. I want you to do it.
Learn more at nashsurgery.com.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mount area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't rise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
What is Celebrate Recovery? It's a Christ-centered, faith-based recovery program for anyone dealing with life's hurts, habits, and hang-ups. Celebrate Recovery meets every Thursday night at 7 p.m. at Farmington Heights Church in the Wilson, Raleigh, and surrounding areas. Please join us every Thursday night at 7 p.m.
When Jay arrived at the emergency department with a hernia, he was in pain, scared, and unsure of what would happen next. That's when he met Dr. Clarice Monnier.
The way she conveyed, it was something that I could understand. She didn't talk over my head. She called me at home on her cell phone just to see how I was doing. They really treated me like family. I just can't say enough, and I wouldn't be hesitant to come back here.
Learn more at nashsurgery.com.
Buying a Toyota should be as fun as driving one. This is Trey Turner from Rocky Mount Toyota, where we've made the car buying process simple. Get straightforward pricing on all your favorite Toyota models, so you can skip the hassle and the haggle and get back on the road in no time at all. Plus, enjoy the peace of mind that comes with our complimentary lifetime warranty, unlimited time, unlimited miles. Come see me today at Rocky Mount Toyota or shop online at RockyMountToyota.com.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mount area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't rise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
Trade It still buys and sells pretty much everything. Tools, phones, computers, video games, stereo equipment, and just about anything else you can think of. And yes, we still pay the most cash for your gold and silver. But today, let's talk about something exciting. Our all-new upgraded jewelry department. We now have a beautiful selection of silver jewelry at unbeatable prices and the guaranteed best prices in North Carolina on stunning lab-created diamond jewelry. Now here's the thing, every other jewelry store in town is going to have prettier jewelry cases. They look like they're straight out of a big budget Hollywood movie. Some of them will even offer you a free glass of champagne as you shop. But we both know none of that's really free. You won't find any of that at Trade. What you will find is jewelry priced about half of the sale prices at those fancy stores. So you walk out with a bigger smile and a heavier wallet, and guess what? We've also got financing now, so you can take that beautiful piece home without breaking the bank. I'm Fred George, the guy who spends a lot less on fancy frills and free champagne and passes the savings on to you. Come check it out at Trade, located next to Wells Fargo Bank at 2916 Sunset Avenue, right here in Rocky Mount. And while you're in Trade It, don't forget to register to win a free 1-carat diamond ring set of beautiful white gold. Just scan the QR code on your screen right now, fill out the form, and you're registered.
And welcome back to Call the Doctor. We are really enjoying our conversation tonight with Vantreia Gross. She is with Carolina Regional Orthopedics, and you can certainly give them a call at 443-0400. There we go. But our number, if you'd like to call and ask her a question, is 407-1111. Be happy to have you call. Now, you brought some pictures.
I did.
Now, we're going to show you some wounds. Lee, if you will bring the pictures up, let's see what we have. And you can talk to us about those pictures.
Okay, so this is one of our patients. He had a burn, but he is a diabetic. So this technically is considered a diabetic foot wound. And he was cooking something, dropped a pot of grease on him. And I don't, there should be another picture in there with the first wound. That, yes. So that's what came to me. And this was, let's see. He had had it for about 4 weeks or so. Yeah, he had had it for 4 weeks before he even said anything. Never told his family, kind of walked around like that. So he's such a sweet guy. And we just laughed and joked the entire time that we were there. But if we can go back to the first picture, this was healed in 6 months.
Wow.
Yeah. So a lot of times it's it's just trying to get patients' mindset to change.
Right.
Instead of looking at the wound as a negative,
right.
It happened. Get past. We got to move forward.
You've got to meet them where they are at the time and go forward.
Yes.
And that's what you do. And I like that. I like what you said about that, because there's no need in beating the patient up because you know, they feel bad enough.
Yeah.
That they have this.
Yeah.
So
yeah.
Anyway, we'll move on with another picture.
So this gentleman, so I find humor in a lot of things, and so I try to make patients laugh and joke during these visits, because a lot of times it's not fun.
Right.
Sometimes it can be a little bit uncomfortable. And so he got beamed by a softball. He's a softball coach, and one of his ladies beamed him in the leg.
Oh, wow.
And so this happened, let's see here. This happened in May 19th. And so, May 2nd, and he came to see me a couple weeks later.
Right.
Because it ended up looking like that. So the black and even that yellow is what we would call necrotic. So it died. And what's funny is when I cleaned everything out, it actually, the muscle died all the way to the bone. So we used something called a wound vac. So a wound vac is actually a really great concept. It is a sponge that is attached to a suction. And what happens is you put the sponge in the hole, especially if you have depth. You put the sponge in the hole, and what it does is that it kind of does this and it does this. So it sucks everything together.
Okay.
And its job is to decrease the wound size each time. And so we saw him twice a week. We used some collagen. As we know, collagen's in our skin. And so it's great to put in a wound to help promote healing. And next photo. Oh, that is after I cleaned it out. And I think I've been treating him for maybe a month with a wound vac. Wow. And so that's him. And that was 4 months later.
Now, Vantreia, what about scarring?
That is a great question. So the longer you've had the wound, the more likely it is you're going to notice it once it heals.
But you know what? If I was in that position, I don't think I'd care about a scar.
Most people don't.
I would be so happy to have a scar because it's healed.
That's it. Most people are so excited when they see their scar.
Right.
And when the wound starts getting smaller and smaller. And so you can hardly tell where his original wound was. But yeah, he went on to heal. And that was about 4 months.
Very good.
He probably will not have a scar because it was such a fresh wound.
Okay.
Now, if you have somebody who's had wounds for years, they're going to notice a scar.
Right. And we hope that folks won't do that. We hope folks will be proactive and go ahead and come immediately.
Please. Yes.
Okay, next picture.
That's, there should be another one. Nope. Nope. That. So this is a gentleman who had a tractor fall on his leg. And so this is a skin tear.
You know, it's amazing the variety of things that happen. I mean, I bet you see so many different things.
And I think the sad thing is two people can have the exact same wound and the outcomes can be so different.
Right.
And so this is technically a skin tear, but it's a skin tear with a venous component.
I was going to say, now, are these people diabetic already before
no, he's
these
not a
things
diabetic.
happen? Okay.
He's not. The other gentleman wasn't.
Wow.
So this one is not a diabetic, but he had poor circulation.
Okay.
And that's why he didn't heal.
There you go. Okay.
And so we used a wound vac on him. And we used some collagen under the wound vac. And back one, it got to that. Back one more. And now it's healed.
That is so good.
And you can hardly see a scar.
So, and that's all the pictures, I believe. Is that right?
Are there any more?
Are there any more, Lee?
So this gentleman is so super sweet. He had a very unfortunate turn in his life. He was homeless for a little while, and he didn't have anybody to look after him. He got most of his care from the emergency department. And one of his main problems is high blood pressure.
Right.
And when your blood pressure is not well controlled, you end up with swollen legs. Super swollen legs over a period of time, your skin starts tearing. And so if you look, you can see some red streaks in there. That's where his skin tore apart and it's bleeding. And next picture. Ooh, are there any others of that one? There. And you can actually see the discoloration in his legs. So one portion is a lot paler. That's because he was weeping. So when I say weeping, it literally is almost like your skin is crying. So much fluid is coming out that it just, when we saw him, the chuck underneath was just drenched. Wow. And so it doesn't really matter what we put on this wound, it will never heal until you get the swelling out of his legs.
Right.
So we use compression. And that usually is my biggest battle with patients. Compression's not fun. For our ladies out there, if you've ever worn a girdle, it is compared to that. It is not fun.
Are you saying compression?
Yes.
Socks or?
No, I have a compression. I have a compression wrap.
It's a wrap. Okay,
yes, I always start off with a compression wrap because I can't guarantee the patient's going to wear their socks. And a lot of times, those socks are very hard to put on. If you do not have a lot of motion and strength in your hands, those socks are very hard to put on.
Okay.
And so we used a compression wrap. It's a 2-layer compression wrap. And what it does is it gradually pushes the fluid back up. So I always warn patients when I put them on for the first time, you're going to notice more drainage. You're going to notice you peeing a little bit more.
Okay.
And so he got on board immediately. I actually had to strongly encourage the patient to use his own compression socks because he loved the wrap so much.
Oh, wow.
Yeah. Most patients, once they start compression, they realize that this is what I need. And so with him, I think we had a few setbacks because his skin was very fragile, but we healed him in, I'd say about 8 months. And
Very
so,
good.
yes, next picture, that actually is a great picture. So this young lady, and I say young, our young elderly lady, so she is different. So you see how swollen her legs are. That's a problem. But if you look close at her wound, the border or the edge of where that yellow is really red. Yes. So remember we talked earlier about infection. That actually could be thought of as an infection, but that's not infection. That's a disease called pyoderma gangrenosum. And so
I don't have to say that.
And what it is rare, but it happens. And a lot of times it happens in some immunocompromised patients. And it can take anything simple like a bump. And all she had was just a bump.
Wow.
Which caused a skin tear, which caused her skin to just, her body to just flare up. And so usually it takes a lot of work to treat that. Those patients are extremely painful. She needed compression. And once we started using compression, she realized that it helped because her legs became less painful. And we started using steroid cream. And she went on to heal.
Wow.
I think this was about 3 months, but she went on to heal.
Very good. Well, these are wonderful outcomes and stories. So let me ask you, I won't ask you percentages per se, but do most people have a good outcome?
Yes. I've had some failures. There were a couple that, I know we talked earlier about amputation. Amputation was their option.
Okay, Lee, you can come back to us now. Okay.
Yeah, amputation was their option. And it's always unfortunate when somebody loses a body part. However, they're living their life.
Yes.
And they're so much better now than when they had that infected wound. They're up, they're moving around. when I say when people look sick, it's just something about them that looks sick. I've seen these patients after amputation, and they look happy. They have so much life and so much joy.
Right. Wow.
So sometimes that is an option.
Okay. Well, let's talk about, we've talked a lot about wound care. You have another question?
I do.
Okay.
Are there any at-home remedies to help blood clot wounds heal faster in between visits?
Blood clot wounds.
I can't say that I can think of anything off the top of my head, because I'd like to actually know exactly what they're talking about.
Right.
So ordinarily, if somebody were telling me they have a blood clot, that would be a problem in their blood vessel.
Okay.
So I'm not exactly sure what they mean when they say a blood clot wound. So if that is something that you're questioning, by all means, come and see us.
Yes.
And I'll be happy to talk with you about it.
Okay. All right. Thank you for calling, though. We always appreciate all of our callers.
Yes.
So let's talk about the services at Carolina Regional Orthopedics. So you have all kinds of docs, all kinds of PAs, you know, FNPs probably, and all of that.
Ironically, no, we have no nurse practitioners.
Okay, just
we're
PAs.
Yep, we're PA heavy
docs.
practice.
Okay. And tell us what you offer at Carolina Regional Orthopedics.
Excuse me. So obviously, we're orthopedics, so we have orthopedics.
Right.
We see everybody from any hand injuries, wrist, elbow, shoulder, and that's Dr. Perlmutter. He's our hand specialist.
Okay.
And then we have a couple PAs that work with him.
Okay.
We have a PA that does foot and ankle.
Okay.
So anybody who could see, one thing we don't do are, you know, clip toenails.
Yeah.
We were not equipped to do that.
Right.
But we do see any acute ankle foot injuries, any chronic ankle foot injuries. We have a joint specialist who does hip and knee joint replacements as well as revisions.
Okay.
So a revision is if you've had one joint replacement and either you've had an infection or the joint just aged out.
Right.
And you need another one. That's
So
your
who
gentleman.
who does
That's
that?
Dr. Kim Kerr.
Okay, Dr. Kim.
Yeah, that's Dr.
Okay.
Kim Kerr. Vince Keeney does our foot and ankle.
Okay.
And then Joe Williams and Paul Kelly work with Dr. Perlmutter in the hand clinic.
Okay.
We have pain management.
Very
So
good.
if anybody that needs chronic pain management, come and see us.
And that's Dr.
headed by
McNichol.
He's
been
by
on
Dr.
here
McNichol.
too.
Yes.
So I think we've had all the docs.
Yes, and so William Mayo and also Joe Williams and myself work with Dr. McNichol.
Okay.
And we have practices in Bertie,
Okay.
as well as in Tarboro.
Really?
Yep. And we have surgery, shoulder specialist. That's Dr. Hardy Singh.
Okay.
And I work with Dr. Hardy Singh as well as Vince Keeney.
Okay.
Morgan, I think you've had on here, Morgan
Yes, we've
Batchelor,
had Morgan.
works with Dr. Kim Kerr.
Okay.
So everybody has their doctor, but we all kind of help each other.
Right. Well, that's what makes it a well-rounded orthopedic practice. So anyway, everybody, it's a team.
Yes.
So great team at Carolina Regional Orthopedics. And they're located right off of Zebulon Road. What's the name of the road y'all are on?
Patrick Court, 110 Patrick Court.
Yeah, right off of Zebulon Road. You can't just take a left turn off or right turn, whichever direction you're coming. But anyway, we hope you will give them a call. The number's 443-0400 for anything you need, any of your orthopedic needs. I think, as we said, they're pretty comprehensive.
Yes.
Practice. So.
Anyway. I'm sorry, I forgot to mention.
No problem.
We have Joe Williams that also sees spine.
Oh, spine too?
Yes, so we
Okay.
have spine care there.
Very good. Very good. All right. Well, we certainly enjoyed you tonight,
Thank you
Vantreia.
so much.
I just feel like I'm overwhelmed with so much information that I didn't know. I mean, this has been so informative. I really appreciate you coming, and hopefully you'll come back again.
I would love to. I had a blast.
Okay, very
I had a
good.
blast.
All right. Well, we will see you next time then.
Thank you.
And thank y'all for watching.
I was told to do that.